All right, guys, welcome to our vlog number 6, and
Is
we
it?
have our old friend, Dr. Dean Casewell, and now we have our new friend, Melanie. So we're just gonna stay with the first name for in terms of a HIPAA compliance, and not mentioning where you at, Melanie, since you are a patient in this case. So we were just talking about how Melanie was seeing other PTs during the course of her injury. So you want to start?
Yeah, sure. So I have been more or less injured, I think, since 2017, like I've described to you guys before in the write-up. And I think I started seeing PT at the end of 2018 when I was training for a marathon. I think most of the time I've seen two PDs in total. I have one PT 2018 and then the other one 2019 from my colleagues recommendation, and but both of them were not their suggestions and recovery plans were not very effective, at least for me. So the exercises they suggested me are mostly body weight exercises, things like glute bridges, or clamshells, which it's useful maybe for most people, but at least based on my workout intensities at the time, it didn't really have the sort of stimulus on me as expected. Yeah, so that's sort of it. And so I stopped seeing PT basically after my last marathon last December, and I was still badly injured, of course, after the marathon. It's probably the worst injury ever I've had, and I haven't really recovered from it. I did some little exercises, tried to stretch, but I still like greatly suffer from the injury from the marathon.
Dean, do you have any follow-up question?
Well, I mean, we need to get a little bit more specific on just with the physical therapist. Did they give you a diagnosis? Did they actually ever give you a physical therapy diagnosis of regards to what they were trying to treat at that time?
So I think both of at the time they were both mentioning that I have very weak glute muscles. That's the diagnosis at least at the time, and most of the exercises were assigned to strengthen glute muscles. So at the beginning it was right side, and then later on it was left side. Yeah, that's pretty much it.
Did you tell them the same injury history that you told us, like with the same extensiveness?
Yeah. I think pretty much the same or similar. It's probably not as extensive because at like this time I had a lot of time to think back about every single case I had. So it's probably more extensive this time compared to before. Yeah, but it's roughly similar. Yeah, I started seeing. I think I started seeing the first PT when I was training for marathon in 2018. At the time, I had a pain on my right foot and a slight pain, and also my right glute was really bothering me as I was training for like longer mileage, weekly mileage. So that's when I started seeing PT the first time, and then after the race, I changed to a different PT. And at that time, the problem has already shifted to the left side. Yeah.
But you said in your document that you kind of fixed the right glute pain or the right hip pain at the time.
Yeah. So yeah, that is right. But I think that's mostly related to my cross training and just weight exercise that I was doing by myself. So because I realized that maybe it was my glute problem, but maybe it's because the intensities of the exercises assigned were not high enough. So I was paying a lot of attention to like cross training. I was doing like running and biking and swimming at the same time. I was also lifting weights, and I was also practicing a lot of like simple exercises at the time. So I feel like that kind of fixed the problem at that point. Yeah.
So now on the left side, I mean, you wrote it out, but let's go over it because it's kind of important to get the kind of subjective concept of your symptoms and how would you describe them on your left side, where they're at, what their sensation like, and I'll follow up with a couple of questions after that based on what you give us.
Yeah, sure, totally. So my left side started bothering me when I think it was last April. So after the marathon. The marathon was fine. I did not have any pain during the marathon, but after the marathon, when I was recovering, I started to feel the strain on my left hamstring. And at the time, I just took 2 weeks off from running and came back to running again. And I thought, okay, if I build up mileage from that point, it should be fine. But I actually didn't. So very soon, I started to have very intense pain on my left hamstring and also my left glute. So my left glute has been like the core sort of problem in this entire injury. So I tried to do some exercise, but I just didn't really have enough time for that. And also I didn't want to get too sore the second day. So I was mostly just focusing on running itself. So right now, how my left side feels is mostly like, so right now when I'm sitting down, and if I move front and back, I can feel a little bit tingling on my outer hip. And also I can feel a strain on like under my buttock. So that's roughly where it feels the most. I also feel a little bit of soreness and tingling on my outer calf, on my left side. Yeah, and every time when I try to do stretch and sort of inner thigh or hamstring stretch, I feel the like the top part of my inner thigh like sometimes it has this sharp soreness when I do the stretch. Yeah, so that's roughly how it feels. And when I go out running, it does not always bother. So sometimes I can feel like a sudden sharp pain on my left glute. And if I start to run faster, the left hamstring would feel like it's trying to stop me. Like I could not lift my left leg up.
Right. Okay. Okay. Good. Good. So, in looking at diagnosing things, let's what you've just said is a couple of really good important pieces of information. One, sitting can aggravate under that buttocks bone in that area. Running sometimes can set it off, but if you do go into a faster pace, you increase your symptoms or have a higher potential for increasing or aggravating your symptoms. Is that correct?
Yeah, that's right.
Okay. Now, you also do two other training components because you're a triathlete. So let's talk about, do you get any symptomology in this area with either your swimming or your cycling activity?
Yeah, so for swimming, I have the same problem during swimming. So when I swim, like I can't really kick very intensely. If I try to go to like a threshold pace, my left glute would very quickly like stiffen, and sometimes I can feel like a numbness on my left glute when I try to swim faster. And for cycling, it's more like when I'm sitting in an arrow position where my left glute and hamstring would bother the most, or if I try to go to a higher watts. And also I think I've mentioned this to you guys that my right hip flexor started to have this sharp soreness recently after I basically stopped all of the other exercises, only bicycle. So it feels like I cannot lift my right leg. Yeah.
What swimming stroke do you usually feel the pain at? Or
yeah, so I swim freestyle, so I just do front crawl with the kick. So that's like basic the most of the time I do. So if I try to do like breaststroke, that would not be I wouldn't feel like as intense of the of my glute side. Yeah.
Have you noticed with your swim stroke, and this may be something you do or don't do, but within the kick motion, if you focus on keeping a little bit more of a straighter, stiffer leg within your kick motion versus more of a flutter-based kick with your motion, do you notice a difference in the potential of symptoms?
So yes, I think when I pay more attention to the kick, if I try to straighten my legs slightly more, that would feel more intense. Whereas if I would try to relax and mostly rely on the arms, that will feel better. Yeah.
Okay. 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 Great. Perfect. Thank you. So when we're looking at something like this, and in the overall components of the patterns, your description and symptomology is definitely, it falls into the category of a hamstring type of tendinopathy. You have some of the normal subjective signs as well as objective pain producers, but you also have a couple other pieces that kind of fall into what we call differential diagnosis, right? You have the numbness, the burning, both in the buttocks region as well as down in the leg. Now, oftentimes it's associated with the nerve that comes right next to that. And when the tendinopathy or the inflammation gets high enough, what you can often see is it'll irritate that nerve right in that same area, going down through the leg, the posterior leg, and to the lateral side of the calf lower region. So that's pretty common, but something that we'd want to pay attention to a little bit. It also could fall into the category of whether or not there's a little bit of a piriformis component going on in association with your hamstring when it comes to looking at trying to differentiate what's primary, what's secondary, and how we want to go about treating it. The final piece of the puzzle has to do with kind of your sacrum and your pelvis position, okay? Because as you mentioned with the biking, the hip flexor on that right side. Now, I have a hypothesis on that, and if you're seated and going in a normal higher revolution RPM for your training, you're trying to get into the 75, 80, 90 RPM, lower resistance, but really kicking it up, trying to get your aerobic rate up, you're doing okay. But the minute you increase that wattage, increase that resistance, you start to notice that right hip flexor component. Well, oftentimes what's happening is if you can't push well with your left side, your right hip flexor is going to try to help pull on the pedal component to try to give you that extra, especially when you're in the saddle and trying to drive. And the minute you stand up, that will often get better because all of a sudden you can use a little bit body weight to create push down through that left side, and you now don't have to pull as much with the right side. So at the moment, what I want to tell you is you got to watch that intensity component until we get more things calm down so that you don't go into this adaptive pattern of really trying to pull with that right hip flexor, because it's just trying to help out the fact that you're not driving well with your left. Or even in your mind, when you have to increase the level, really focus on, okay, I'm going to get my core really engaged and I'm going to drive down through my foot, keeping my foot in that good, stable, set position, not letting the ankle flop, keeping it really set, and driving down through that pedal with the left side and trying not to over pull with the right, okay? So that's kind of diagnosis and a little bit of.
That makes a lot of sense. Yeah, I think that makes a lot of sense. It's like it feels. So here's the thing. Like I was practicing. So there are a few technique practices in my bike training, and I might have overused some of them, basically.
Yeah, you're just like every other runner and triathlete I've ever worked with. It's like, yeah, there's no stop. There's just maybe a little bit less, and then we push it again, right?
Yeah.
Okay. Good. The other part too that we don't know, we need to kind of look at a little bit, is your pelvic alignment can be a little bit off too. You did mention all the way back when you first started having some right-sided problems that the course you ran on was high on the right side the whole time. It was a
Yeah.
loop, right?
Yeah.
And so you're literally running, like this with your pelvis and your hip, because you're running this way around and around and around, always pushed up. And so there's question of whether or not at this point too, your pelvis is actually in a neutral position, or is one side driven a little forward or back comparatively to the other. How is that all looking? If that's the case, think of it, if we're looking at you and your pelvis here, what you think about is if your pelvis on one side is turned slightly forward. So say this is your left side. Yep, left hand. If your pelvis is in essence rockered a little forward, what it's going to do is it's going to take your hamstring and it's going to put it on length. And so your hamstring's already on stretch. And then you go and try to work it, and it's working and adding load while on stretch. So we want to try to get you out of that. And so as we get into this, we'll talk about a couple of things in regards to, all right, looking at these differential diagnoses, how do we go about getting you to do potentially some resets due to the fact that if it was Katie or I working with you, what we would do is mobilize your pelvis back into position, teach you how to hold it and stabilize it, right? But we got to figure out a way for you to do it yourself a little bit.
Telehealth.
That actually reminded me of another observation I had. I think this might make sense. It makes sense to me because so when I was training for weightlifting last year, so if I'm squatting with a heavy weight, my hip would shift towards the left side a little bit more. So it's almost like I'm sitting to the left side a touch more, maybe because my left leg was having a hard time pushing it up. So I couldn't really figure it out at the point. I tried to fix it myself, but it was not really successful. So I still had that bad habit. So when I squat, I would shift to one side.
Okay. Yeah, so what we're looking at here is a couple of different things. We're looking at, the fact that subjectively you show a sign of hamstring tendinopathy, but you also show some symptomology that could rule in or rule out an aspect of a little bit of a piriformis syndrome, a little bit of nerve irritation of the sciatic through that space, and then a little potential bit of pelvic sacral alignment in the whole mix of things. So we're going to focus on the major components, but also kind of deal with some of the other pieces so we can see if we can bring you out of this pattern. Because sometimes the small little piece of an alignment issue can be the biggest piece of the puzzle. If we don't figure that out, it doesn't matter. The hamstring's going to continue to be on stretch. You're going to continue to stress it, and it just keeps feeling a little better. Then you do a little bit more, and then you go backwards. And it's just does this. So I'm better. I'm adding load. Oh, there's my failure point. I go back this way. And then you do that thing. And we want to get you out of that pattern.
Cool. Yeah, me too.
All right, Miss Katie, what's the next component here? To go.
We can do some assessment right now. We couldn't do the sacral mob, but we could probably see her single leg squats or start with single leg squats first.
Yeah, so let's
you want to check out her lumbar first?
Well, that's the key. I guess that's the other subjective question that you would take someone through is does she have any lumbar pain? Are there any symptoms in the low back region or even around the tailbone?
I've asked her. She has not. Well, she's here, so she hasn't told me she's got any lower back pain. But
no, I don't have lower back pain. Yeah, I think a lot of people mentioned and ask if I have lower back pain, and I'm always like no. So.
Yeah. So I think the lumbar should be fine. So let's see a single leg squat. Let's see the right leg first.
Okay.
Yeah, well, yep.
Oh, you probably need to.
Yeah, drop the camera down a little bit.
Yeah.
Is this good? Can you see me?
Well, we want to see the another face camera. Yeah.
I see. I thought you want to see me side.
Well, we can see the side later on.
Should I lift my left leg like this? And
Yeah.
slow down?
Yeah, we can do a pistol. It's not bad. All right, try the left leg.
Have her talk. I can't see her.
Oh, you cannot see her?
No.
What happened?
I don't know. When you're talking, I lose
All
you.
right, you need to. All right, go to upper right hand corner. Switch out of speaker view. Ding, are you on phone or are you on computer?
I'm on a phone.
Computer.
Okay. All right, I'm gonna shut up so Melanie can do it again.
Cool. So right side. Yeah.
Okay, now go back to the right side.
Okay.
Okay, and drop down into 1/4 squat. And now go up, down 5 times, kind of up, down quickly. Up, down, up, down, up, down. Yep. Okay, now left side, please. Yeah, so we definitely have a difference between the left side and the right side on the control factor. It starts already a little bit in towards the midline, and as you try to go a little bit quicker on your right side, you're really nice and smooth. It's nice and controlled, really nice and athletic looking. Left side, you lose a little bit of control, have to recatch yourself.
Mm-hmm.
So definitely seeing a little asymmetry between your left and right side control there. Yeah.
Any pain with that, or you're fine?
So here feels a little bit of tight, but that's pretty much it. Like slight tightness.
Okay.
Good. Okay. What would you like to see next, Katie? I know what I want to see next.
Is it the twist?
What do I want to see next? I do want to see her hip abduction and adduction muscle strength. I don't know if there's a way for us to do that right now.
Probably not easily.
Do you have some sort of a chair or some sort of platform?
For me to stand on, or?
No, for you to sideline on, or.
Yeah, I think I do. Hold on. I have a bench here.
Oh, she's got a bench.
I figured out finally on my phone how to see all 3 people at the same time. So
I'm glad you're tech savvy.
We're good now.
How do people even do telehealth? This is so hard.
You know, I don't. There's only so many, in my opinion. There's only so much within certain things that you can truly do with the telehealth, but there's just limitations in it without being able to just put your hands on it, feel it, truly see it. There's stuff you can diagnose and things, you know. And I'm going to have her do a provocation test after we look at this to see if we can reproduce the proximal hamstring and a couple of those things, but it's not like being able to put your hand on somebody and do your differential diagnosis, right? It's much more complicated.
Yeah.
Yeah.
Okay, so what should I do, KT?
That bench is a little high. Here. Let me send you a picture.
Okay.
But Ding, you can definitely check what you want to see if that's not what you want to see.
No, that's good. I want to see that too, but I want to see just a little provocation test where if you use that bench, where if you put your leg out on the bench into a position where in essence you'd then go from a hip hinge into, in essence, trying to hamstring stretch, do you get pain? So there's your right side. That side feels okay?
Yeah.
All right. All right, so then bring it down and then go left side and same thing. And do you reproduce any pain or symptoms with that?
Yeah, so left side definitely feels tighter than the right side.
Yeah.
And I have, when I do this,
Yeah.
I can feel a little bit of tingling on the, it's not really on my outer hip, but it's more like on the left side of the glute.
Okay. Is it anywhere near your tailbone or your butt bone in essence that you would sit on?
No, so it's more like around here.
Okay. Okay. And so then if you also lay on a nice firm surface, take the leg up, bend the knee towards the chest, and then go to extend. Try right side, then bring it to the left and extend. And do you get any symptoms in this zone of the buttocks here?
Okay, let me see.
Hold it a little longer. Flex your toes.
Huh?
Bring your toes towards you. Do you feel any symptoms?
That's right.
Oh, my bad. At the IT.
No, not really like this.
Okay. And so those are just two potential provocation tests for the proximal hamstring. There's potential, I mean, and it's just like anything else, depending on how inflamed the tendon is, those tests can be really indicative or partially indicative. I'd say they're both saying that there's something happening with the hamstring, but it's not a great, strong, okay, this is tendinopathy versus potentially a little bit of piriformis based component that's going along with it. So let's.
I sent 2 pictures in the group chat, so I want to see both position.
I see. Okay.
So you can do either a hip abduction first, which is the first one, or you can do the single leg.
Okay. Let me try if I can replicate it. Seems a little bit complicated.
Which one?
The adductor bridge is, yeah.
Okay.
Yeah, so
You might need to lower the camera a little bit.
Okay, I'll lower the camera. I will also switch to the direction of the bench.
Okay.
You can see me.
This involves a lot of patience.
The beauty of what you're doing here is you've gone from first, in essence, stretch provocation test to now a loading provocation test. So the single leg bridge is a high load on the proximal hamstring. So if she's positive, that tells us something. So.
Am I doing it right?
Yep. Well, you are doing right, and it looks beautiful.
And bring the leg up to it.
Like this?
Yep.
Okay.
And lower it. Don't touch the floor. I couldn't see it.
Is it right?
Right hip up, and can you lower the left leg and then bring it up? Try 10 times.
Okay. Take a break.
Was that hard?
That was a little bit hard. Okay.
Okay.
Like this?
Yeah, and lower it and bring it up. Try to straight the leg. Now straight the leg. The bottom leg. Yeah. Parallel to the upper leg. Yep. And bring up.
Bring it up to the bench.
Bring up to the bench. Are you getting tired?
Yeah.
Any pain or any of your symptoms?
I feel sore on left glute, like here.
Okay.
Yeah, but that's pretty much it.
Do you feel anything on your inner thigh?
Oh, okay. So inner thigh has. Okay, now I'm starting to feel it. So inner thigh feels very tight and a little bit of tingling, but not really when I was doing the exercise, but when I stopped it.
Okay, interesting. Okay, so guys, we got a problem. This meeting is ending in it's 8 minutes.
Oh no.
Melanie, do you have the upgraded account?
Hold on. No, not on.
Not on Zoom.
Not
Okay,
on Zoom.
so when it ends, we're gonna start another one, so we get another 40 minutes. Sounds
All
good.
right.
All right.
That works.
I hate it. Why does Zoom does that?
I don't know. So what about the other test? What about the single leg bridge test? The
Yeah,
second
let's do the single leg bridge test before we regroup.
Yeah, because that one's really provocative to the hamstring.
All right, cool. So should I do it on left side or right side?
Do it
Left
on
side,
both.
Okay.
but left side's the key.
Oh God. All right, bring it down. And go up. Try 10 times for me. Try to do it slowly.
All right. Yeah, I feel a little bit of tension, like strain, on the hamstring, but it's very minor.
Okay.
And so presentation wise, we're kind of like our patterning is not necessarily completely fitting the really strong tendinopathy issue, which to be honest is not a bad thing, because tendinopathies are a bit of a treatment load to fix when you truly have them. It's going to require cross friction work and massage work, and then gradual exercise strengthening to then loading and then to increase in activity. But your presentations aren't coming through, even though you got a little bit of the subjective components. The strength of your assessment components are not really strong on the tendinopathy side of things. And like I said, that's not necessarily a bad thing, because tendinopathies can be a little bit more of a long-term treatment process that just takes time, where more and more of it's looking like potentially we've got a bit of a pelvis and sacrum alignment issue with some neural issue of where the nerve passes through that pelvis of yours and going underneath your piriformis. Now, piriformis wise, again, you could find your piriformis is tight, but again, that's pretty common when you, again, if the pelvis is in a position that's tilted and the sacrum rotates with it, of course, your piriformis changes length on one side and the other side based on how it attaches to those bones. So that can also create a little bit of closing of space. And the fact that you're getting this adductor component also says, okay, if this is happening, okay, hamstrings on length on one side, adductors being pulled in length on that same side as well. It's all saying, okay, we've got an imbalance in position. We have a positional fault happening between your pelvis on right side versus left side. And how do we correct that? How do we make changes to that potentially? Because without being able to just palpate right into your hamstring tendon, which is what, of course, if we were together, I'd just put my thumb right into your hamstring tendon and it would tell us right away that, yes, I'm aggravated. But then again, we got to figure out why. And you're not quite fitting a really great pattern in the sense of the tendinopathy. And so let me think about how we would want to. So one thing we could look at, Thomas.
Before you say that, let's regroup. We got 3 minutes left.